will try to show you, and please have patience with my English because so many times we use it. So I'm expecting to show you about some analysis into the experience of professionals who incorporating the complementary therapies in their care. And for that, I will invite you to come first to know how is the situation in Chile, and then we will know a main text, then some text that I proposed, and then we can speak the conclusions. In Chile, this is our pyramidal population pyramid, and if you can see, much of us are adults. We have each time less task of fertility, and now under the 20% of us is children. So we have a little population on these years, and for them the second cause of death is cancer. The more frequent is leukemia, and with almost 500 new cases per year, we have in our two systems of health, we have both private and public, survival at 5 years over 73%. So here in Chile, accreditation is carried out by Ministry of Health, the MinSal, which defines the hours of training in the quality of academic formation of students. Now, the ministry only certifies the practice here in Chile for acupuncture, naturopathy, homeopathy. These are legalized here of T&CM, and floral therapy and masotherapy are in project, okay? Other therapies are in process of being accredited. Therefore, the therapists are only certified by the training centers, who are few. And the only the 43% of these therapists corresponded to professionals of the healthcare area. So, looking this, herbal therapy is the more used here in Chile, as in the other countries, as we learned with Murat and the other professors. We have very species, as in your countries, who the people, the unsick people, use for health reasons. Because the T&CM, it is looked more than a cultural health. We have some places here, as this, who is an hospital of transcultural care. Okay. But this is not the reality of all. This is not the reality of each place in the country, and in the city. Oh, sorry, Mohammed, I feel noise. Can you? Thank you. So, then it is not the reality of all the country, I told you. Then we will see a special research, who pretend to delve into the experience of nurses who provide complementary therapies to pediatric patients in Chile, and to describe how parents of pediatric patients perceive them. Okay. The main text that we will study is this one. Is from Paula Vega, Marcela Urrutia, Viviana Aliaga, and Solange Campos, who are nurses here in 2 universities in our city, in Santiago. And they make this analysis into the experience of health professionals at incorporating complementary therapies in their clinical practice. Okay. So, in the last 2 decades, many healthcare professionals agree that these therapies can be used complementary to the practices of scientific or allopathic medicine, observing that people improve their health, have fewer side effects of pharmacological treatment, and improve their quality of life. Furthermore, some studies have shown that healthcare professionals are also users of these therapies, especially nurses. Maybe we are coming from witches or wizards, so we have more affinity. Those studies report that they have benefited physically, emotionally, and spiritually, which have generated important change in their lifestyles. In this context, it is necessary to go to prove how deep is this experience. So the investigators proposed a qualitative study with a phenomenological design. This is because this kind of design allows to place in the light something that can become visible in itself, okay? So they called professionals, health professionals, by snowball method, who practice the profession in public and private healthcare centers in Chile, and they have the experience of incorporating complementary therapies into their professional practice. So the inclusion criteria were a healthcare worker with more than 1 year of professional practice who had obtained certification for formal training in the complementary therapy they perform, and who had permanently incorporated into their practice. After an invitation by mail, because was happened under pandemia, they, if the professional was agree, he was coming to a private office, and then one of the researchers make the interview under the guideline question: what has been your experience in incorporating a complementary therapy into your clinical practice? During the interview, other questions were asked that will allow us to probe deeper into dialogue. The narratives, once literally transcribed, were subject separately to a thematic analysis by the researchers. And then had all triangulations to reach the findings, researching a consensus of the units of meaning, and thus structuring the essence of the phenomenon once the data was saturated. Okay, so during the process, compliance with the methodological rigor proposed by Guba and Lincoln was ensured. And they found 8 men and 4 women health workers with an average age of 45 years old and an experienced years of 19 years. All of them were certificated in 2 or more TCIM, Reiki, floral therapy, Chinese medicine. All were owner users of TCIM. So they made in the study, they chose 3 themes, 3 means results. Then the TCIM give greater meaning to the work of healthcare professional. And the challenge to generate they needs. They say that we need challenge to generate greater integration with allopathic medicine. And they spoke about facilitators and obstacles. So at first, please read the words of this nurse. She or he spoke about how she thinks that the philosophy behind Oriental medicine is very profound, and its meaning plays an intrinsic part of the therapists themselves. There is something very deep-seated behind all this, where I believe our Western medicine has forgotten its origins, and it has been reduced, modernized, concretized, materialized, and therefore we practice it without the deep meaning it originally had. They then experience in themselves the beginnings of CT, and then they start to help another because they knows that it is expanding the therapeutic tools, and then they can be more satisfied because they can do this kind of care. So they made this, they note this, and they think that is they are includes a better person or more grateful. They know that the mostly referred to by professional therapists is the personal growth achieved thanks to the paradigm on which complementary therapies are based. Then they note how broad therapeutic tools, and they report that the use of the CT on their professionals practice allows them to have greater skills in evaluation and therapeutic intervention, complementing their disciplinary knowledge and becoming a very valuable please tell me if you understand, therapeutic tool. Yes, so they spoke about they feel the satisfaction who CT generates in them in their professional work as they expand their professional skills, managing to embrace the person as a holistic being. They note how they can help to sweet death with less pain, in more calm. They note how can they relieve the stress in the children that they care. So another main results was that they notes that we need challenge to generate greater integration with allopathic medicine. Their challenge is to promote this integration from their reality in favor of the integral health of human beings, and in turn give meaning to their own lives. They note how the biomedical paradigm is quite close, and it is not enough to care the people, to care each person. So they speak about how we need this integration of the therapies, and how do we need to incorporate in that acknowledgement in the curricula of the health profession to humanicize them. They note that biomedical paradigm, it is not enough. And they speak about that we need how beyond just the technique, it will include the meaning and the philosophical basis of complementary therapies, because they note that the curricula could be more humanized. Yeah. So this study speaks about how the use of TCIM allows the person to connect with consciousness and their own being, to develop mainly emotions and spirituality, dimensions that are generally forgotten in the biomedical paradigm. They reach the same results of Bellis and Rojas, and they note how the health professionals, the healthcare people, it is not feeling satisfaction with only techniques than they learn. Regarding the implication of the use in the clinical practice, one of the findings then of this study was that the participants perceived that they help themselves within the therapeutic process, generating a relationship of mutual help between patient and professionals. So I talk you about that maybe we as nurses speaks of some things like this in many ways. We have theorists like Leininger with the model of the sunrise, talking about the structure dimensions that we need to know our healthcare people. We know the theory of care of Jean Watson, and she notes and she speaks how, in fact, the nurse patient, she spoke about nurse, about the nurse patient relationship within transpersonal care achieves this type of mutual help by favoring sensitivity towards oneself and toward others, and generating an authentic therapeutic relationship and nurturing, for both people. And exist so near to the to our paradigm in TCIM, no? The integral nursing theory of Barbara Ducey. So she spoke also about the different dimensions that we need to know for to be effective in our care. So this was the main article that I need to show you. But, sorry, Ahmed, I'm bad. And I need to speak about something more. Because the study of Paula Vega and the other investigators is so related with some done in my university we are making, and then we are now in edition for to publish it. So I beg your pardon, and I want to show you something. Those the things that the research, little research that I will show you are on were evaluated by ethic committees, and they were accord with Emmanuel requirements, so of research. So in 213 and 216, we make quantitative research about use of TCIM in pediatric oncology patients, first with 49 nurses and second with 94 nurses, asking them about the ways for to care with TCIM, which kinds, which therapies, what therapies they used, and what I don't know, what obstacles they note. Then in 2019, we asked to patients about their experience with the TCIM. In 2021, we asked to nurses again about their experience, but now both of these were qualitative studies. And now we are making another one with how the nurses, we are a school of nursing, how the nurses applied this TCIM in the nursing process, yeah, in the different steps of the nursing process. This was the tool that we asked to the nurses about what kind of TCM they used. At first, we asked what they knew, and then what they use, and many of them knows many kinds of therapies, but only a few use it because we ask to pediatric nurses, yeah. So they use therapies that they notes, then they know, then don't disturb and don't affect the body directly, because they think that they can make some damage. And here I told you only the 40% of the therapies of TCIM are professionals of health. And we have only under 20% of these nurses with studies approved. So they use art therapy principally for to make the diagnosis. With mandala, with color therapy, they works with children for to make the diagnosis about, for example, their animals, their grief, their pain, and then they apply love therapy, music therapy, and Reiki, most of them. And in 2013, we saw how much more of the nurses spoke only about ambiental measures, significant presence, and some about Reiki or musicotherapy. But 3 years after, the people knows more about TCIM. So much more people, more nurses make Reiki and speaks about music therapy, about TCIM. They feels, I speak again about this, they cannot make in children another kind of therapies because they don't know. Reasons then to make TCIM in nurses are because decreased stress associated with the medical and hospital experience, are because release of tensions, fears, and lower indicators of depression, because development of imagination, creativity, and achievement of new learning. Yes, it's good for both, because they note that the children have more adherence to treatment, and because the personal satisfaction, yeah. And the obstacles are the lack of acknowledgement. We make research looking the curricula of the main 30 universities in our country, and only one have TCIM in the curricula in nursing. So even the young people wants to know more about it, because they are hearing and knowing about TCIM. They don't have in the undergraduate someone who teach them, and not in the university exist few centers for to learn another kind of therapy like Chinese medicine. Another obstacle is the resistance from allopathic healthcare, because from allopathic exist the beliefs about that the TCIM is only for people who is making things without base, because we don't have many studies. So it is our reality, yeah. So some of our references, and then I am here if you have any question.
Thank you, Mara, so much. It's really very interesting to know something new from South America. That's really, for the first time I hear presentation about the use of traditional complementary medicine from South of America. I have just a few questions for you. You have mentioned that there are about 500 new cases per year with childhood cancer in Chile, right?
Yes.
May I ask about the general population of Chile? How much
Yes.
general population in general?
20 millions, almost.
Okay.
Almost 20 millions.
Okay. And what? How many centers did you say there are in Chile for the pediatric oncology?
We have 4 centers. We have a net. Here is PINDA, yeah, the pediatric national centers. We have are 16 hospitals in the net. Because we are a long country, yeah. So 16 for to make better to the people to reach to them, and then exist another centers, 5 for help to them in the therapy for to help them. Yes, and 4 centers more in cities more far. Yeah, yes, Julia. Calvo Maquena is one of the bigger, yeah. Yeah, is one of the bigger, and Calvo Maquena is the next with San Jude, okay. And yes, and Sotero del Río and Roberto del Río are both big hospitals, public hospitals, but 3 of them are in our main city. So we need more hospitals for to care, and the bone transplant is made only here in the Calvo Maquena and in some private clinics. Yeah, St. Jude's partnership.
Okay. Julia Sharinor have written that Chile is longitudinal, of course, even in the map. And because of that, I want to ask about the use of traditional complementary medicine. You have said by the adults, for example, it's about 80% of the adults are using herbal therapy. Because of that, I want to ask that if, do you have some numbers to tell us about the delay in treatment? Because of course, many patients are living very far away from the center,
from the
maybe
diagnosis,
they are using the traditional complementary medicine.
We have a system. We have a system, national system, between the diagnosis of the children to start the treatment can pass 14 days. 14 days, and then we start quickly with all the chemo or the kind of treatment. So for that reason, because we improve the first diagnosis and quick fair treatment, we can decrease our death line numbers. But we have we have few specialists, doctors specialists in oncology in the extremes of our country. Yeah, so the children most of them must come to the center for to start the treatment or to make the bone transplant. But for chemios or this kind of therapies, they can return to their original center. Okay. Maybe we need to teach more professional, not medics, not doctors, because we have there a lack of acknowledgement, for example, in how to make with the Hickman catheter with the different kind of catheters. And then we have the risk for the children because maybe the nurses or the different kind of healthcare people don't know what is the risk of infection or the different kind of. Mm-hmm.
Okay, and what about the time interval between first symptoms until the diagnosis? I think in this time interval, many patients may use the traditional complementary medicine just to heal fever, for example, or pain or swelling, they think maybe, and they don't seek the medical advice. And because of that, the diagnosis is delayed. I want to ask, do you have some information about this issue?
We have a national program. I cannot now here show you maybe, but exists a protocol and exists in all the country. So if someone in the public system or in the private system knows a children who is starting with any kind of symptom, tumor in osteosarcoma or brain tumor, they have few days. In 14 days, the boy must to be with the specialist. And if when he's in treatment, he have bad symptoms, as you said, because he have I forgot the name. The decrease of immune system. I don't remember.
Yeah, immune compromised. Yeah.
Yeah. Yes. He must to can reach to go to the hospital. Exists a system for to do it, okay, and so he must to be. He must to go to the urgent ER of the nearest hospital, the nearest center, and if he needs, he must to be transported to the other hospital with more resources.
But of course, there are a lot of children who are not registered and just going directly to traditional or complementary medicine without registration system. Huh?
Yes, it's been a high effort, but we have good results. But I worked in my first years in public system, and then 9 years more in private system. Okay, so for me, exists a big distance between both of them because in private system we have a survival of more than 93%. In leukemia is 98%, 97% in leukemia. So exists a big distance, and this distance is because the difference in treatment. Okay. We have a protocol in the national program who is a good one, a very good one. But for example, the children who need a bone transplant will be the children, the boy who is coming in his third, no, not leukemia, but
relapse, you mean?
Recaída. Julia? Recaída?
Relapse?
Yeah. Yeah. So, thank you. So only him will go to the bone transplant. But in private system will be in the first.
Okay.
So is
big difference, yeah. You have mentioned a concept. I like what you have said. You have said some nurses think it must be all-inclusive healthcare moods.
Yeah.
I like this sentence very well. I think
Yes.
that it must be our mission for all of us, all the doctors and nurses. We must offer this all-inclusive healthcare mood for our patients. And you have also said that a lot of nurses are working already or working in the T&CM for helping the patients, but there are a lack of knowledge due to lack of this curriculum during the study. So
yeah.
from where did they get the information or the training?
Most of them start with themselves because they were patient, for example, of Reiki, they receive Reiki, or the herbal therapy is in all the places, as in your countries. Yeah, or for more ancient people is the usual.
Yes.
Mm-hmm.
Yeah.
But but as in your countries, the people don't speak about what are they using.
Mm-hmm.
Yeah.
Yes.
But,
yeah.
But in children, from the acknowledgement of the ancient, for example, we learn to use in oncologic patient aloe vera, and I don't know the name of one, two plants to reduce the infection and reduce the inflammation. Mm-hmm. So many times even in private system, if the mother asks, we can prepare it as teas or something like this, infusions for to mixed. Yeah. And then, but it's because they acknowledge experiments, have experience before in themselves. And few of them is only because they have the needs of to learn, the scientific curiosity. And this kind of people is who looks for how to learn, for example, Chinese medicine. And we have some making acupuncture. And, yeah, and Kui Yong, and I don't remember the other one. It's I don't remember the name.
Thank you, Julia, for the direct corrections.
Yes. Yeah.
Okay. It's open for anyone for any other questions. If any one of you have other questions or comments?
I have, if you like me.
Yes, please.
Thank you very much. Myra, thank you very much for your presentation. It was very clear and comprehensive. Thanks a lot. And may I learn that you mentioned that in nursing curricula, there are only a few faculty or nursing school which have placed TCM in their curricula. And what about the situation for medical faculty? I'm trying to learn for all health professionals, how they are learning T&CM in the faculties, and if lots of schools don't have a place in this topic in their curricula, what are they waiting for? Okay. Which kind of evidence you need?
Okay. Thank you, Jantan. In nursing exists only one. in medicine faculty exists another. In another university exists one who shows them but it's optional to learn about TCIM. Not for other careers, not for other professions, So the people is going to holistic centers, and they found there some teachers who learn in other countries or principally. The nurse or the health care people who wants to, for example, Reiki is in centers far from hospitals. Here we have a biomedical point of view, and it's each day is more technical. For us as teachers, is a very big problem to combine to our deans. Then this is a need for to more better care. We don't have good centers. The hospital that I show you at the start of the presentation is a special hospital who is in the south of our country with many indigenous people. So as a kind of transcultural health, they reach the to make that hospital, and the acknowledgement for to care them, the doctors and the nurses, they learn from the ancient of that, from they say the kimches. It's like the wizards, the ancient medics for them, yeah. But we don't have, and now exist in some universities in our south, exist a line of research about ethnopharmacology. So then we are making now there a base of acknowledgement about that the herbolaria, that is the main TCIM here, but we don't, because we don't have a better base of acknowledgement, we don't have where do we can learn. Mm-hmm.
But as you are practicing it directly without an official study or something like that, is there any control? Is there any control over the nurses that they are not doing bad things, for example, or harmful things?
I do not understand. Please again.
Because there isn't any official study or training for the nurses to use the T&CM, and a lot of them are using it already in the practice. My question is there any control from another person or from another institute or something like that over these nurses?
Exist our Ministry of Health is
supervising?
Yes, supervising some centers, but they are new centers. Yeah, we don't have many experience there.
Okay.
It is not the common in South America. I need to talk to you about that because, for example, in Brazil or in Costa Rica, in Argentina even, they have more. We are more closet, and I think is because we don't want to see our roots, we are not ready to see this kind of acknowledgement.
Okay. Yeah.
but not only, let me show you, please. And with this, I can end, because not all is bad here, here in Chile.
As the world grows in population, there are just fewer and fewer places
And let me, I don't know if you are,
where one can really experience.
Ahmed, this is Julia. Do you
one-on-one
allow me to ask your
nature.
question to her in Spanish?
Patagonia is one of those few places.
again, what?
Sorry.
I can like that.
Ahmed, do you allow me to ask the question in Spanish?
Yes, of course, you're allowed.
Okay. Él quiere saber si quién está supervisando a las enfermeras que están dando la medicina complementaria a causa de que no hay ningún estudio que verificar si hay eficaz o si hay riesgo de hacerlo como eso. ¿Hay alguien mirando lo que están haciendo las enfermeras o no?
Only the Ministry of Health, solo el Ministerio de Salud. But no, yeah, Mohammed, she was asking again, who is supervising nurses who are doing this? And we don't have. So for that reason, for me, was better to found that pediatric nurses are not doing more than they knows what they are doing. They are doing art therapy, music therapy, love therapy, and Reiki, because they know that the children can stop to cry and it's sleeping well, but they are not doing acupuncture in children. And they explain that they don't do it because maybe they don't know how they cannot make damage. So for me, it was better to hear that because it was less dangerous.
Yeah, thank you so much. So because the nurses are not feeling that they have the safety of the other complementary therapies like plants or other actions, they're restricting their activities to art therapy, music therapy, Reiki, which they know is not a risky therapy. So she was comforted to know that's all they're doing. They're not doing the others, even though they know them, they don't do them in the hospital.
Yes.
Correct?
Yes, thank you. Excellent.
Thank you.
Thank you.
Listen,
thank you.
Yo
Yes.
yo sé completamente la dificultad de hablar en inglés es una lengua horrible. So I salute you for speaking in English. Really, it's so horrible. My language is terrible. So really, you're very brave and a wonderful presentation. Thank you so much for sharing your experience in Chile.
Thank you. Thank you. What a shame. So.
Any question from any other person?
Yeah, Ahmed, if you allow me. So thank you, Amara, for your presentation. So it was very clear, yes, and very informative. Thank you very much. I just have a comment regarding the teaching about T&CM, even in medical school, as you raised this issue. I remember like during medical school, we never talked about it, and I didn't hear about it until recently. And I think this is something that we have to work on as a health professional, not for nurses, even for physicians. I know that there is an integrative medicine now coming, and it's more on practice, but in our country, in the Middle East, it's not as much known, although we practice it. We rely a lot on herbal medicine. We do them a lot, but we don't disclose, and they are not considered as medicine. I don't know how we look at it, you know, Ahmed, we are almost from the same area. It's really used, and but nobody is talking about it in the medical field, which is something need to be fixed. And I have a question for Mara about what about the disclosure from families? Like, did you face any problem? Disclosure from parents, like parents, would they tell you that we used, or they will wait for your question?
No, the disclosure of parents, it is?
Yes,
Yeah.
will they tell you by themselves
agree.
that we are using?
Yeah, they are agree, and they are so thankful of the Reiki therapist or the herbalist therapist. They are agree because they use something in a house and they have fear of to speak about this. So when the nurse or when the physician wants to make something with the children, they have confidence in them, because
this is my question. Like, if they use it at home, they will tell you that we used it, or they will hide it?
They use it, and they invite to the physicians and the nurses also to their homes to make it.
Okay.
Yes.
Okay.
Yes, but the things that we are learning, I think, it's the needs, the big needs of to make research about this and to share it.
Yes.
Because, for example, Mohammed was asking about the use of honey. Yes, we use honey in injuries, in different kind of things, and but we don't have anything that show it. Now we are starting with ethnopharmacology studies, but we need more.
Yes, thank you. Thank you.
Ahmed, we are not hearing you.
Oh, sorry, excuse me, sorry. I just say that Manal Aliwa have said that she has just started training at Burj Al Arab University Hospital in Egypt for the medical staff on the art therapy interventions and how to use simple techniques to express feelings, feeling safe, emotions, and so on. It's also interesting.
Yes.
Okay, I think it's come to the end now. Thank you, Mara, so much. It was really very informative for, I think, most of us. For the first time, we hear something from South America. New system, another system for us. Very interesting to know all of this information. Thank you so much.
Thank you. Thank you for your patience.
Thank you.
Interesting. Thank you.
Bye.
Thank you.
Okay, see you next month in our next journal club.
Thank you
Bye-bye.
very much. Bye-bye.
Thank you. Bye-bye.